What if the pain in your feet isn't just getting older or a bad pair of shoes? What if it's your body quietly telling you that your blood sugar has been too high for too long? I'm Dr. Richard Benn. I've been caring for patients for more than 2 decades, and I can't count how many times a simple foot complaint has led to a first diagnosis of diabetes. The truth is this: a surprising number of people with diabetes don't know they have it. That delay can cost nerves, circulation, kidney health, and in the worst cases, limbs. Today I want to walk you through 9 foot-related signs that should make you pause, look closer, and act. And one practical thing you can do each day to protect yourself. Before we start, a quick note on why this matters. Organizations like the American Diabetes Association and the CDC remind us that many cases of diabetes go undiagnosed. Catching high blood sugar earlier changes everything. Less nerve damage, fewer wounds that won't heal, and a much better chance to avoid serious complications. I'll explain the science in plain language. Think of nerves as coated electrical wires and blood as delivery trucks that bring healing supplies. And give one simple habit you can add to your day for each warning sign. I'll begin with a short example because it happens all the time. A 67-year-old retired man I saw for what he called just numbness in his feet had been putting off a checkup. He slept badly because his feet tingled at night, and he kept dropping things because his toes felt numb. When we finally tested him, his fasting blood glucose was 214 full-cladn-DL, high enough to diagnose diabetes. That single conversation started a plan that slowed further nerve damage and got his feet into regular professional care. That kind of turnaround often begins with noticing something small and acting quickly. Sign 1. Tingling or numbness in the feet. Many people write this off as, "I'm getting old" or "I slept wrong." But tingling and numbness are the most common early signs of peripheral neuropathy, nerve damage caused by prolonged high blood sugar. Imagine the nerves in your feet like insulated electrical wires. High glucose slowly wears away that insulation, and the wires don't carry signals properly, so you feel pins and needles, reduced sensation, or even a dull deadness. The danger is that without feeling, you may not notice an injury or pressure area until it becomes serious. One practical habit. Take a short daily barefoot check, 5 minutes at the end of the day. Sit comfortably, look at both feet, move each toe, and notice if one foot feels different from the other. If you notice persistent numbness, make an appointment for a blood glucose test this week. Credibility note. Peripheral neuropathy is one of the classic complications described by diabetes guidelines and common in undiagnosed cases. Sign 2. Burning pain on the soles, especially at night. If you wake up with burning, aching, or stabbing sensations under your feet that are worse at night, people often assume it's just arthritis or restless legs. What's often happening is neuropathic pain. The damaged nerves are misfiring, sending pain signals when there's no external cause. Think of a frayed wire that sparks intermittently. The message is wrong and painful. One practical habit: nighttime comfort matters. Keep feet slightly warm with socks if they make you feel better, and try gentle foot stretches or a short evening walk to improve circulation. Importantly, keep a simple diary. Note when the pain flares and whether anything you do helps. Credibility note. Neuropathic pain patterns are well recognized in clinical literature and by diabetes organizations as an early symptom. Sign 3. Wounds or sores that won't heal. People often blame the injury itself. "I cut it gardening," or "I had a blister from new shoes." But with diabetes, 2 problems combine. Reduced sensation, you may not notice pressure or injury, and poorer blood flow and immune function, that's slow healing. Recall the delivery truck analogy. Blood delivers oxygen and nutrients to repair tissues. When trucks can't get through, repairs stall and small wounds can grow into serious infections. One practical habit: Inspect your feet every night for any break in the skin, especially between toes and on the sole. Clean minor cuts with soap and water, cover them with a clean dressing, and call your doctor if a wound isn't visibly improving within 48 hours or shows redness, increasing pain, or drainage. Credibility note: delayed healing is a major reason diabetes is linked to higher rates of infection and more intensive foot care needs. Sign 4. Skin discoloration around the ankles or lower leg. When the skin around the ankle looks darker, reddish-brown or mottled, many people assume it's poor hygiene, eczema, or just bruising. In some cases, this discoloration signals reduced circulation or small vessel damage related to long-standing high blood sugar. Poor blood flow changes how skin looks and how waste products are cleared, producing a mottled or darker appearance. One practical habit: gently wash and moisturize your lower legs daily and compare both sides in a mirror. If you notice a new, persistent change in color, make a note and schedule a glucose check this week. Persistent discoloration deserves clinical evaluation for circulation and skin health. Credibility note: skin changes around the ankles are a recognized clue to vascular and metabolic issues in older adults. Sign 5. Chronic cracked heels and very dry skin. Many blame weather or cheap socks. And yes, environmental factors matter. But in diabetes, there's a specific mechanism. Damage to autonomic nerves, the ones that control sweating, reduces moisture in the skin. When heels dry out, the skin can harden and crack. Those cracks can be more than cosmetic. They're entry points for bacteria and can lead to infections that are hard to treat if circulation and immune response are impaired. One practical habit: after a shower or bath, apply a thick, fragrance-free moisturizer or heel cream to your feet and heels nightly. Avoid cutting calluses aggressively at home. Instead, gently file or soak and see a foot professional if needed. Credibility note: autonomic neuropathy leading to dry skin and fissures is frequently noted in diabetes care guidance. If you've noticed any of these 5 signs, type yes in the comments right now. Hit the like button if this is useful. It helps this information reach someone who may not realize their feet are trying to speak to them. Sign 6. Persistent swelling or pitting edema in the ankles and feet. Swelling can be caused by many things, but persistent edema, especially when pressing the skin leaves a temporary dent or pit, can indicate problems that deserve urgent attention. In diabetes, swelling may point to compromised kidney function or heart strain. The kidneys help regulate fluid balance. When they're not filtering properly, fluid can build up in the lower legs. That swelling masks wounds, increases pressure on the skin, and can progress quickly. One practical habit: if you notice new or increasing swelling, elevate your legs when seated. Avoid long periods of standing and make an appointment with your clinician promptly. If swelling arrives suddenly, is severe, or is accompanied by shortness of breath or chest discomfort, seek emergency care. Credibility note: organizations focused on kidney health and diabetes emphasize that edema can be a sign of worsening kidney or cardiovascular issues and should not be ignored. Sign 7. Severe stabbing or shooting nerve pain that is often misdiagnosed. This kind of pain is sometimes labeled incorrectly as arthritis or pinched nerve, particularly when it's sharp, intermittent, and seems to come from deeper in the foot or lower leg. Neuropathic stabbing pain is different. It's often electrical, sudden, and can be triggered by light touch or movement. Because it's intermittent, people delay seeking help, attributing it to a one-off strain. One practical habit: keep a pain diary. Record when the pain hits, what you were doing, and what relieves or worsens it. Share this information with your clinician. Early diagnostic testing for blood sugar can reveal an underlying metabolic driver. Credibility note: neuropathic pain syndromes are well described in diabetes literature and can be mistaken for musculoskeletal problems without careful evaluation. Sign 8. Feet that are always cold, even in warm rooms. If you can't warm your feet despite layers of socks, poor circulation is a likely cause. Peripheral arterial disease, narrowing or hardening of the arteries, reduces blood flow, and blood, remember, is the body's heating and repair system. People often chalk cold feet up to low room temperature or aging, but chronic coldness, especially if combined with other signs like slow-healing sores or changes in color, should be evaluated. One practical habit: incorporate gentle, regular walking into your day. Even short, brisk walks help stretch and open the small blood vessels in your legs. If you smoke, consider quitting. Smoking worsens circulation, and stopping is one of the most effective things to improve blood flow over time. Credibility. Note: vascular issues causing cold extremities are a common complication associated with long-term elevated blood sugar and are monitored in diabetes care pathways. Sign 9. Loss of hair on the lower legs or tops of the feet. Hair loss on the lower legs often seems like a harmless cosmetic change, but it is a classic marker of poor circulation. Hair follicles need a steady supply of oxygen and nutrients. When arteries are narrowed, hair thins or disappears. This finding is one of the clues clinicians use when they suspect peripheral vascular disease. One practical habit: check for hair loss on your shins and the tops of your feet during your nightly inspection, and gently run your fingers along the ankle and shin to sense temperature and compare pulses if you know how. If you notice hair loss combined with cold feet or leg pain when walking, schedule a vascular check and a blood glucose test this week. Credibility note: hair loss on the lower limbs is a recognized sign used in vascular assessments. A few practical points that tie these signs together. High blood sugar affects the body in patterns. It damages nerves, it impairs small blood vessels, and it can harm other organs like the kidneys. That combination explains why different problems, numbness, wounds, discoloration, cracked heels, swelling, coldness, and hair loss can all point to the same underlying issue. The good news is that early detection gives you options. Even if you're diagnosed with diabetes, interventions, starting with clear information and prompt clinical care, reduce further harm. Now, a simple 30-second checklist you can do tonight. Sit down with a chair and a light, take off your shoes and socks, and look at both feet side by side. Check the soles and between the toes. Press gently on the top of a toe and see if you feel the touch equally on both feet. Look for cuts, blisters, area of redness or warmth, cracked heels, changes in color, and any hair loss on your shins. See if one foot feels colder to the touch than the other. If you have any persistent sore or wound, especially if it is not improving after a couple of days, call your clinician right away. If you find any of these signs, here are clear next steps. First, schedule a blood glucose test this week. Many community labs offer inexpensive testing, and you may hear prices around $12 for a basic screening at certified labs. Many seniors also have coverage through Medicare for diagnostic testing. Second, if you notice a non-healing wound that has not improved in about 48 hours, or if you see spreading redness, drainage, increased pain, fever, or new severe swelling, seek medical attention promptly. These are signs of infection or worsening circulatory problems that need urgent evaluation. Third, if you're experiencing sudden or severe pain, new weakness, or shortness of breath with swelling, get emergency care. Let me return to the idea of everyday actions that add up. There's no single home remedy that will erase diabetes, but small, consistent habits support nerve and vascular health and reduce risk. Walk for 20 to 30 minutes most days if you can. Prioritize whole foods and fiber when possible. Hydrate. Moisturize your feet nightly to prevent cracks. Inspect your feet every evening and avoid tight shoes or walking barefoot if you have numbness. If you smoke, talk to your clinician about ways to quit. Smoking speeds up vascular damage. These steps are supportive, not curative, but they matter because they keep wounds from happening and help your doctor detect problems early. A few common questions I hear from patients. Is this only for people who are overweight? No. While weight and lifestyle are risk factors, diabetes can affect people with many body types. Does age alone cause these problems? Some small changes happen with age, but the combination of these signs is what should trigger concern, especially when several appear together. Do I need expensive tests? Not at all. A basic blood glucose or hemoglobin A1C test is widely available and affordable in many settings. It's the first step. A final practical tip about footwear and routine care. Choose supportive shoes that fit well, avoid tight socks that leave deep marks, and avoid walking barefoot if you have numbness. If you notice corns, calluses, or thickened toenails, see a podiatrist rather than attempting aggressive home trimming. Regular professional foot care for people with diabetes or suspected neuropathy prevents many small problems from turning into major ones. To summarize, your feet can be early messengers of elevated blood sugar long before you feel anything systemic. Tingling or numbness, burning pain, non-healing wounds, skin discoloration, cracked heels, persistent swelling, stabbing neuropathic pain, chronically cold feet, and loss of hair on the lower legs are 9 signs that should prompt a closer look. If you detect any sign tonight, schedule a blood glucose test this week. If you find a wound that isn't improving after 48 hours, or you notice worsening swelling or signs of infection, contact your healthcare provider immediately. Remember the patient I mentioned at the start, the 67-year-old whose numbness led to a fasting glucose of 214. That diagnosis changed his path. He started a care plan, learned small daily habits to protect his feet, and avoided what can become a much harder problem when unattended. Early detection makes a real difference. If this message spoke to you, share it with a family member or friend who checks on an older relative. And if you want practical weekly conversations about senior health and ways to prevent problems before they escalate, subscribe to this channel and come back next week. Your feet are telling a story. Listen to them, look for the signs, and act. It could change everything.